Okay, here we have Ed, and just about 4 months ago, we decided to do some laser cell signaling with the human umbilical cord tissue for his spine and hip issues. He also had some sciatica. I think we were making some progress, then he hit a roadblock, and actually the sciatica and hip pain kind of flared up. So we decided to add some shock wave, pulse wave, and some other therapies such as the back on track decompression and high powered laser. So how is the hip and sciatic pain now, 4 months later?
It's much improved. I think in the form I had a full flat. I think I put down 70%.
Oh, wow.
Today's not a good day.
Okay, it's up and down.
Today, yeah, no, I've got lower back pain.
Okay.
But my hip is much stronger than it was.
Okay.
It still needs work. No
Yeah, but the fact that we were in a bad place like last month.
Oh,
and then after all the after all the stem cell stimulating therapies, we got you 70% improved. I'm real happy with that. So yeah, we're going to continue with those therapies, and then there's a new machine called TrueDose PRP we're going to add to your program.
What does that do?
So what it does is, I think I mentioned before, normal platelets plasma, where they take your blood, spin it, and they inject it back in your hip or your joints. It doesn't tend to last because just like your body's stem cells, the older you get, they're not as regenerative. You get less count. And those platelets, just like stem cells, they're not as vibrant because they get older. But now this machine, it analyzes your blood, and according to your blood health, like inflammation or whatever, it will calculate through artificial intelligence how many platelets you need to heal damaged tissue or inflammation in your body. And so with the machine, we could count exactly how many platelets you need per dose. Because traditionally, every time they draw your blood, they spin it, separate the platelets from your blood, put the plasma back in with the platelets. They don't know how much they're putting in you, so it could be various. But now you don't have to guess. Like, let's say the machine says you need 1 billion platelets. We're going to draw enough blood to get 1 billion. After we spin it, we could count it before we put it back. So I think this will just take, your regeneration to the next level. Okay. So you come back in a couple days to get that done.
Yeah.
Okay, great. Yeah, and today we'll just go with your normal shockwave and laser treatments just to keep the progress going, and we'll see you in a couple days then. Okay.
Yeah, I'd have to check my calendar. Sure.
Worst comes to worst, we could get you in next week. It's just that the inventor of the machine's going to give personal training to us. So we figure, hey, we want to get our VIP best patients in just to make sure, hey, you're getting the standard, the original protocol from the inventor. So
how long?
We see a half hour. Yeah. Okay. Yeah.
Okay.
I just tell Noah, he'll squeeze you in. But again, you're one of our VIPs. I want to make sure you get in. Okay.
Oh, okay. Well, thank you very much. Appreciate that.
Okay. All right, so just go out and get your shockwave, and we'll go from there. Okay.
Okay. Now, what about ongoing? What's besides this platelet count?
Yeah. So just like your first injection with the cells, we want to do this, let it settle in for a month, and do a reevaluation. And the worst comes to worst, we can always do the shockwave and everything else to keep the cells stimulated. All right.
All right.
Well, like I said, we're only 1/4 of the way there. A third, because again, we're going to work with you for a year. We're only 4 months out now, and you're already 70% better. So better things to come. Well, hey, we're always investing in the latest and greatest. So
okay. Well, I appreciate that. Yeah.
All right, Ed. Go ahead and schedule that out, and we'll see you in a couple days. Okay.
Okay. Thanks very much.
All right.
Cheers.
Well, you're moving a lot better too. You're just
I'm
not limping. So
I'm moving much better.
All right.
Probably the last 4 days, I've noticed it. Often you don't notice yourself, right?
Yeah.
But in the last 4
and what
days,
about the sciatica?
Just today, I've got this pain right here.
Yeah.
That's any
But
problem.
what about the sciatica, you know, up until, yeah.
Yeah, I get sciatica, and when it comes on, I have an exercise that I do that ameliorates it.
But now when you're standing a long time and walking, it's not as prevalent then, huh?
No, the situation is much, I mean, beforehand, I was
Limping, yeah.
like that, right?
So even the sciatica is at least 70% better, huh?
Well, yes. Yeah.
That's great.
It's much improved. Much improved.
All right, Ed, we'll keep on going. I'm glad you're not limping, so.
Right, thank you.
Bye-bye.